Okay, so I have chosen COPD for my chronic illness, and I'm using the American Lung Association's website as a source of education and resources for patients and their families. So you would go to www.lung.org. Pretty easy to remember. Um, it's going to talk a lot about different lung diseases, especially COVID right now, since COVID's a big thing, and of course is the lung disease. So I just simply search COPD in the search bar, and just click this first link here, and it brings you right to their education and resources for COPD. So it first talks about a couple different resources for COPD. They have the Better Breathers Club, the Better Breathers Network, a COPD management plan, which we're going to actually review in a little bit here in this online support community. So these are mostly kind of like communities of um, people with COPD as a way for them to connect. So I thought that was great. Um, this is just talking a little bit about the pneumococcal vaccine because, of course, if you have any sort of lung disease, you're at greater risk for respiratory viruses in general, but especially pneumonia. And we have a vaccine for pneumonia. So if you're at high risk, then of course we're going to suggest that you get it if it's appropriate for you. Um, this is just box here that pops up sometimes. So I like the way that they have things laid out with this website. I think it's pretty straightforward and easy for our patients and their families to navigate. Um, so we'll kind of just start right here. It's learn about COPD. Just kind of like talks about what exactly the illness is. Um, and kind of just like in layman's term for your average person to understand. Has COPD in women. Women are more vulnerable than men to lung damage from cigarette smoking. Has to do with the lungs being smaller, and it looks like they think estrogen might have play a role in it as well, which is interesting. Especially since right here it says COPD is thought of as a man's disease, so I thought that was pretty interesting. I'm just gonna go back here. You have causes and risk factors. So smoking is definitely a huge risk factor. It's probably the biggest risk factor, um, especially uh, when you're smoking cigarettes. I mean, smoking anything isn't great, but cigarettes are the big one. So when we're talking to our patients with COPD and educating them, if they are still, or if they just are cigarette smokers in general, those smoking cessation informational things are going to be very important for these patients. And these are just like kind of some quick facts about risk factors. Air pollution is a big thing. Secondhand smoke is a big thing. Um, and then it has some like suggestions on how to reduce your risk for COPD. The biggest one is to stop smoking, and if you don't smoke to begin with, don't start. So we'll go back here. This has some symptoms and diagnosis. It talks a lot about the dyspnea with your everyday activities. It talks about treating COPD, living with COPD. This is actually nice, I thought, this right here that's highlighted for healthcare providers. It's just some resources for them, which I thought was interesting. Here, we can click on it quick. Um, Again, it talks about smoking cessation again. That's a big thing with our COPD patients. And then some more resources here. It mentions those clubs again and the organizations that we saw at the beginning of this video. So I love this part. This is one of my favorite parts of this website. So it has videos and resources. So only a few videos, and we're not going to sit here and watch them. Uh, but I did watch them before this. So they have this pursed lip breathing video, and it's going to teach our patients or our family members the methods of pursed lip breathing, and how that's going to kind of help them when they're having episodes of dyspnea throughout the house. um, how to use and how to clean a nebulizer. Maybe not always, but oftentimes people with COPD are using nebulizers to help break all that sputum and phlegm up and try to cough it out. And then it also has a video about belly breathing. Um, and that is also just to help with their symptom of feeling shortness of breath. And we know that belly breathing really isn't a good sign. That usually tells us that at that moment our patient is really struggling. So for the resources, they have this COPD action plan. I believe this was the one in the beginning that I said that we would look over. And they also have it in Spanish, which is awesome. So this is something that the patient and their family would want to be going over with their provider. It has this green, yellow, and red zone. Um, Once you're at the red zone, that's saying that you need urgent medical care and you should probably call 911. So the idea of this is for your provider to go through this with you, and kind of mark off these actions to take if you are experiencing these symptoms. So, of course, if you don't smoke cigarettes to begin with, they might just cross all these off anyways because you should avoid inhaling these things, um, but things like that. And then for the red zone, you need urgent medical care. Chances are you should call 911, get to a hospital immediately, especially if you're having this chest pain and coughing up blood and things like that. And then it has this second sheet right here, and it has like a management plan. It has just kind of like your general information. Again, like your provider is going to be helping you fill this out. Talks about your vaccines and COVID in the recent years. So now we talk a little bit about COVID here. Your medications, you know, some patients we have, they take medications every day and they don't always even know like why exactly they're taking it. They just know that their doctor tells them to do it, so they do it. So I thought this was neat. It has like the purpose of the medication as well. It has like a quit plan again for smoking cessation because that's one of the most important things with COPD is to quit smoking if you do smoke or remove yourself from um, an environment where you might be exposed to secondhand smoke. Um, so we'll exit out of that one. Um, has ABCs of using a nebulizer, which I love. So it kind of just goes through exactly how to set up your nebulizer. Um, it has assemble and clean. Oxygen, using oxygen safely. I thought that was another important one. Again, I'm talking so much about people smoking cigarettes, but even when people are diagnosed with COPD and are needing to use oxygen, they do still smoke. And it's really important to talk to our patients about that because fire and oxygen do not mix well together. So that's a really important teaching point, in my opinion. Talks about lung transplants. Um, Not everyone's eligible for that or would even want that. So there's information on there about that. People with COPD, of course, are at high risk for frequent respiratory illnesses. So talks about recovering from lung infections. And then I also love now they have steps you can take to get used to wearing a mask. So now we live in this COVID world and we have to wear masks all the time, especially now, even if you are vaccinated, we should really be trying to wear masks when we're in large crowds. So when somebody has difficulties breathing to begin with, a mask can feel suffocating to them. So I like that they also include this in their resources and information. Um, Staying active, because even if you do have shortness of breath, you still really should try to be getting your exercise in, right? Um, Again, talks about the benefits of quitting smoking. It has this palliative care worksheet, which I think is nice because a lot of people hear the words palliative care and they just hear death. They think, oh, this means that I'm dying like right now, but we know that that's not always the case. Palliative care workers are great for helping patients alleviate all sorts of different symptoms. It doesn't have to be, because you're dying. And then it has this medication tracker, which I also thought was a really nice resource. It talks more about like what is this medication for. Um, you know, I said earlier, patients sometimes just take their meds because that's what their doctors tell them to take, and they don't even always know necessarily what they're taking them for. So this would be nice, and this is just like nice to have on you and keep around, especially if you're taking multiple medications. I think this is going to be a good way to help you stay organized with your meds. And if you're having any side effects from your meds, you can have it written down and kind of know, well, like, okay, well, this is normal or this isn't normal, and maybe I should call my doctor now. Um, yeah, so there's like a lot more to this American Lung Association website. I focused on COPD and tried to focus on these resources as healthcare providers. This will be very helpful for us, and it will be very helpful for educating our patients. This website is easily navigated, and I think has a lot of good, clear information that's, they use layman's terms so it can be understood easily. And yeah,